And thank you for taking the time to be interviewed with True Star. It means a lot. What are some of the most important things that we've learned about the COVID-19 virus so far?
That could be a very long answer. I think, when I think about almost 3 years of COVID at this point, I think we've learned a few things. I think we've learned that the virus itself keeps changing, right? That the version of the virus we were fighting in 2020 is pretty different than the version of the virus we're fighting in 2023. And so because the virus keeps changing, it's important that we also, stay up to date with the tools we have to fight it. And vaccine being the top one there, that I am so pleased that we were able to get a safe and effective vaccine rolled out back in early 2021, but that I think the whole world is feeling very tired of COVID, which I understand, but staying up to date with those vaccines as we update them, right? There's this new version that's available, just after Labor Day this year, just in the fall, but we didn't see a lot of Chicagoans necessarily choose to take it. And I worry a little bit that we're doing a reasonably good job of keeping up on the science front as the virus continues to choose, but on the sort of getting the word out, people having this be part of how they keep themselves healthy, I think we are lagging behind. And so that is something that I worry about. I think the other thing is just that we've seen, I think I'm very proud of the work that we've done in Chicago, not just the health department, but really all of Chicago, I think really for the most part, came together around COVID. We saw a lot of people do things differently. The fact we're doing this Zoom interview, we never would have done that before COVID. We've seen lots of opportunity to kind of, I think, bring opportunities sort of online, but also you have some possibility to leave people out then if they are not connected, if they don't know how to use it. And so how you sort of balance some of those new ways of working and new ways of interacting and things that I think are very good and healthy for participating and getting to know each other, how you balance that with still really unequal access and knowledge around things like using the internet. You look at, older Chicagoans, they're much less likely to be plugged in. And as we've moved to, more things being online, I think that's an exciting thing, but it also has the potential to leave out, those who are older, those who don't have broadband at their homes. And we have not seen COVID hit this city the same, right? It's not a surprise, but we've seen people with fewer resources also get hit hardest with COVID. And that's not different than what we've seen in other outbreaks, but I think it's really brought it to the forefront, and that there are, real inequities in this city. And we got to work on those far beyond COVID. So that was a lot of things, but those are some of the highlights.
Got it. Thank you.
Mm-hmm.
And my next question for you is, has COVID-19 moved from being a pandemic to being an endemic?
So the word pandemic basically means a big global spreading of a disease, a global outbreak. I would definitely say we are still having a global outbreak of COVID. So the pandemic, so-called, is not over. But what has happened is we've moved from a stage in the pandemic when we didn't have the tools to fight this well, and we needed to be, turning our life upside down and shutting things down and, very, very worried about overwhelming hospitals. It's moved now onto the list of diseases that I think are going to be with us. So in that way, I think, yes, it's endemic. I don't think it's going anywhere, but it's also not quite down to a level where we fully understand it or where we can fully predict it. And so, if I think about influenza for a comparison, there was a pandemic 100 years ago in 2018, and it's not like that ended in we never had flu to worry about again. What happened is we saw sort of over the years flu kind of settle down into this every winter, we have a sort of predictable surge, but we have the tools to fight it. And I think we are on that pathway for COVID. And so for me, it's about making sure that we as a society do what we can to kind of stay ahead of it with vaccines, with treatments. If people do get COVID, make sure people have access to healthcare, right, is a big piece of this. And then it becomes something that is probably going to be a part of our lives, but it doesn't need to upend our lives like it did, at the very beginning, thankfully.
So you mentioned that you think the COVID-19 virus is something that'll be a part of our lives for a while. In your opinion, is COVID-19 something that'll be a part of our lives forever?
So COVID-19 is one type of a coronavirus. A coronavirus is this whole class of viruses, and we had coronaviruses long before COVID-19. There's a coronavirus that just causes the common cold. But the thing with COVID-19 is it was so much more contagious and so much more dangerous, so much more deadly, that I do think it's not shown any signs yet of going away. And coronaviruses have always been with us. And I think that this one is going to also continue likely to be with us. But again, sort of like flu here, COVID-19 is still in the top 3 things that are killing Americans, right? Like heart disease, cancer, COVID-19. And actually here in Chicago, at least last year, it was even beating out cancer. So it's when you have a disease that is one of the very top things killing people still, for me, it hasn't settled down yet to something that can kind of be in the background. So I do think it's going to be around, but I think I hope the death rate is likely to continue dropping, especially if people use the tools to help keep themselves safe. But it's kind of like influenza. We know there's going to be a flu season every winter, right? Without fail, there is a flu season. I think probably what's going to happen is we're going to stop thinking of it just as flu season. We're going to think of it as just respiratory virus season, flu and COVID and the other respiratory viruses, and thinking about sort of being, as prepared as possible, helping protect those who may be more vulnerable, but not, again, letting it upend our lives. I think that's probably what we're going to see going forward. I think we probably will have vaccines updates, maybe even annually for a while here. Just to try to stay ahead of the way that the virus keeps changing. But, for flu, if people have had their flu vaccine, and if they do get flu and they're at high risk, there's medication that can help keep them out of the hospital. We now have those things for COVID, like we didn't at the beginning. And so my hope is that eventually, influenza has dropped down. It usually is right around the 10th or 11th cause of death, right? Like it's still up there, but it's not up in the top 3. And my hope is that over time, COVID also will sort of move back down because it is preventable. A lot of the other things, heart disease, cancer, there are things you can do to help prevent that, but not like we don't have a vaccine for heart disease. We don't have a vaccine for gun violence. We don't have a vaccine for car crashes. We don't have a vaccine for a lot of these other things. The infectious diseases are preventable, really, the serious outcomes more easily than a lot of the other things are. And so, I want to knock these infectious diseases completely off the top 10 list if we can here in Chicago.
Got you. Thank you for that.
Mm-hmm.
And how do you foresee us dealing with COVID in the future?
So, I think if I've learned anything in 3 years, it's that I don't have a crystal ball and that COVID has continued to change and to surprise us in certain ways. We are now more than a year since we've seen a new variant of concern emerge. So Omicron, right, was the new variant of concern that came out last kind of December, January time. Everything that we've seen since then, all of these little subvariants, they're all still Omicron. And if we never see another big variant of concern, I'm not too worried about where we're going here. But I think the worry is that if we do see the virus change a lot, the worst case scenario would be you get a variant that emerges that the vaccines don't work very well against, or the treatment, the Paxlovid, doesn't work very well against, or the tests, it doesn't work very well against the test, things like that. Barring that, I think we're going to probably continue to see some up and down and little surges. But again, my very strong expectation, always putting a little asterisk if we had a new variant of concern that, you know, anything could be possible. My real expectation is this will just become part of our lives, like where people at some level expect they're going to get some respiratory viruses. You know, you'd be thrilled if you went a year or two without getting a cold, right? You'd be really surprised if you never got sick. Like, I think COVID increasingly, for people who are up to date with their vaccines and can take the medicines, it is presenting, you know, not in a way that's going to kill them, but in a way that may continue to make them sick every few years.
Got it. And how is Chicago doing with this fight against COVID-19? Are case numbers going up? Is there a decline? Should we be on high alert?
Yeah, that's a really good question. So we've moved, and the whole country moved in a way that I think was very helpful. The CDC moved to using the same standards, and every single week, every county gets an updated community level, like a risk level for COVID. So every county in the whole country, every single week, gets named low COVID level, medium COVID level, or high COVID level. You keep it simple, right? And the way you move up or down is a combination of, are we seeing a lot of cases that are getting detected in the lab? And are we seeing a lot of people go to the hospital? Are we seeing hospital numbers really fill up? And it's a combination of those things that move you. So right now, Chicago and Cook County are at a medium COVID level. So we're not at nothing, right? We're not low. We're definitely in some surge here. And with the holiday gatherings, you know, we may even move into high. But even if we move into high, as long as we don't see a major surge that starts really threatening our hospitals, that's when we would be encouraging people to put those masks back on indoors and sort of help get those back down. But I think, you know, we continue to track anybody who wants to follow this in Chicago. If you go to chicago.gov/COVID, or, you know, the short is chi.gov/COVID- for COVID dashboard, you can actually see, we update every weekday everything that's happening with COVID numbers right now. So we're, you know, I can tell you overall, about 1 in 20 of our hospital beds across the whole city is taken up by somebody with COVID. So that's not nothing, but it's also not overwhelming the hospitals. We are still seeing hundreds of Chicagoans every day being infected with COVID. And those are just the ones that are getting tested in labs. We know hundreds and hundreds more, you know, are diagnosed through a home test. And we still have Chicagoans dying from COVID, but it is less than 1 Chicagoan per day on average, whereas it was more than 50 Chicagoans per day, you know, at the height of this. And we know right here in Chicago that people who are up to date with their vaccines are so much less likely to be hospitalized or to die. And some of that's on the dashboard. So like, if you compare people in Chicago who haven't gotten a COVID vaccine to people who are up to date with their vaccines, the people who never got a vaccine are 3 times as likely to end up in the hospital, which is huge from a medicine perspective. Like, we talk about things being 50%, you know, 75% more. This is 300%, right? Like, you cut your risk so much by being vaccinated. And if you look at deaths, people who have not had a vaccine are about 6 times as likely to die if they have COVID than people who are up to date with their vaccine. So it really is this tool that has made COVID, it doesn't make it go away, but it turns it into something that doesn't overwhelm our hospitals and doesn't kill people. Almost 8,000 Chicagoans have died from COVID. It's been a big hit here. And the biggest change we saw in that was with vaccine, like, for sure. Because those numbers are regardless of whether people have had COVID before, whether they're immunocompromised or age, it doesn't matter. All comers, 6 times more likely to die if they haven't had a vaccine. And, you know, continues to be just an extraordinarily effective and safe intervention. But we still see people in Chicago, you know, not prioritizing getting that vaccine. And those are the people I worry about. The people who aren't up to date with the vaccine, those are the people who, for the most part, especially if they're older, are the most likely to end up in the hospital or still even today.
Got it. And was there anything else that you wanted to add that we didn't already discuss?
I would maybe add, I know that you're focusing a lot on younger people, younger Chicagoans. And so I would just emphasize that younger Chicagoans have a really important role to play here. Thankfully, people who are younger are much less likely to get seriously ill or die themselves, right? But we do know that teenagers and Chicagoans in their 20s tend to be sort of the most social, really like to go out, like to live their lives. That's amazing. We love it. But it also means that there can be some more potential for spreading COVID. And then we know that those younger Chicagoans are in close contact with their parents, their grandparents, their older neighbors, the folks who are at higher risk for those severe outcomes. And so I would really encourage, younger Chicagoans. I know, I'm a doctor and I talk to people out there, and a lot of times younger people will say, oh, I'm fine. I'm not that worried about COVID myself. And I'm not that worried about COVID for them either. But I am worried about the risk of, to the city and to the people they love, and to their ability to, go do all the fun things that in a safe way. And so I would encourage people, to come up to date with the COVID vaccine, and come up to date with the flu vaccine. And that does mean, because not everybody, there's been such a lot of different boosters and all of this. It means that if you haven't had a vaccine since Labor Day of this year, you're not up to date. You should get another COVID vaccine and you should get a flu vaccine. And think about doing that, not just for yourself, but for all the other people around you. When you're going out and having fun, when you're gathering with older people, younger Chicagoans are less likely to be vaccinated overall, but a little more likely to potentially, through no fault of their own, be out and having fun and sort of doing activities that can lead to more spread. And so I really encourage people, when they're making that decision, to not just think about them, it's good for them too, but to think about how you're helping to protect the others that you care about, and even people you might not know about. It helps us keep Chicago open and running, and we know that young people talking about vaccines with their older family members also can really drive that decision making. And so I think it's a really critical group. And we've tried, in Chicago, we've tried some things to get that vaccine uptake a little bit more. We've heard that it can be hard, younger people are less likely to have a primary care physician, for example, right? So it's harder for me to just say, oh, go to your doctor and get it. And so I want people to know that the vaccines are widely available at pharmacies. You're not allowed to be charged for them, whether or not you have insurance. And we heard from folks that even that, it's hard to make the appointment, figure it out. And so in Chicago, we're I think the only big city, we'll bring vaccine to anybody's house in Chicago. So if you're 18 and up, and you haven't had your COVID vaccine, or you haven't had your flu vaccine, or you're worried about your mom or your grandma or somebody like that, City of Chicago will bring vaccine to anybody's house for free in Chicago. So we'll vaccinate up to 10 people at once. And this can be anybody from the age of 6 months and up. So I would encourage younger people, like, who sometimes, you're talking to each other, you can often really be those forces for change in your family, I think. You can make that appointment. You can call 312-746-4835, or you can go to chicago.gov/at-home, because it's our at-home vaccine. And we've got weekend appointments, we've got morning, afternoon, evening. We're really trying to work around schedules. So you can get your neighbors together or your extended family together. And as long as somebody's getting a COVID vaccine, like, we can do flu vaccines at the same time. And I think, especially where I think about Black Chicagoans, there are more neighborhoods that don't have as much primary care. That's a big problem, right? That's something we're working on. I want to make sure that everybody has equal access to healthcare. But in the meantime, at least for this one thing, because we know COVID has hit both Black and Latinx Chicagoans harder, partly because of not as much access to healthcare, et cetera, not as much trust in the healthcare system. Setting this up to really say, forget the healthcare system. We'll bring you the vaccine, to your home, to wherever you want to get it, to have trained nurses give it to you. That's something we've been trying to do. And Black Chicagoans have actually been the most likely to choose that way of getting vaccinated. And so that makes me glad, because that's a group we especially want to make sure we're seeing better levels of protection and trying to work against some of those systemic issues where there's been, longer term underinvestment in neighborhoods, et cetera. I want everybody to have access to this vaccine. It's safe, it's effective, it saves lives. No matter where you live, no matter what your zip code is, no matter your age, no matter your race, no matter your ethnicity, everybody age 6 months and up. And so I'd love for, younger people to help us get the news out about that, and even take advantage of it and think about getting a vaccine themselves.
Got it. Thank you.
Yeah, you're welcome.
Well, if you didn't have anything else to add, that was my final question for you.
All
I
right.
wanted to say thank you one more time for taking the time out of your busy schedule to be interviewed by True Star. It means a lot to us.
You're welcome. Thank you for focusing on this important topic, and good luck to you.